welcome everybody to our October 2021 health plan webinar. This is a Q&A session for all employees to be able to ask questions. We insert a topic each month. This month we have a really fun topic to add to this, a new feature that we haven't had. And our friend Amanda from Advanta Benefits is back with us again to talk about what that topic is and then answer any questions that you may have. And then as always, we'll record the session and post it online for everybody to view. So with that, I'll turn time over to Amanda. So.
Yeah, thank you, everyone. Thanks, Kevin. So the topic we like to talk about today is this new provider dashboard or provider search feature that we have. So as you know, in the past, the Sound Plan is really unique in that we have the ability to directly engage with providers to create kind of our own proprietary network, for lack of a better word for it. So direct contracts where those of us who work with the Sound Plan reach out to a provider. That might be a provider you're seeing, or it just might be a provider that we see in the community that might be in the future utilized by employees. Reach out, put together a contract for pricing and services with that provider that's specific to just the Sound Plan, to Sound employees. So those direct providers don't fall under a traditional network search where you would go to like a United Healthcare or something and search for a provider. They fall into a really specific one that's unique to us. And because of that, we've been trying to find a great way to communicate those providers to you to make sure that they're really easy for you to see and find when you need to find a provider, or to just kind of know as you're out in the world and trying to use your health benefits so that you can direct yourself to those providers pretty easily. Of course, healthcare or Hawaii Management Associates, HMA, does a really good job of helping direct you when you call in, talk to an advocate or talk to member services. They can help direct you also, but we wanted to find a lot better way to do that. And one of those ways that we did was partnering with a company called Health2Business. So Health2Business is something hopefully you've seen a little bit of, as I know Donna has posted these posters that I'm showing on screen all around and potentially send them through email and post them on your internal intranet as well. Health2Business is this organization down here that helps put together two things. So they help us reach out to providers and build a bigger and bigger and bigger network of personal providers. And they also help us communicate those providers to you. So one of the features of their services is that they take what we used to send is that, Excel table with providers that we try to group into big sections to give you an update on who we were contracted with, who we weren't. What they did is turn that into a much more user-friendly search that's online so that you can go online and search by a provider type and find a provider, or just see big locations visually and click on those locations and be able to see which providers we contract with there. So this flyer, hopefully you've seen, this is our new provider search flyer. So if you clicked into Health2Business and went into their search feature, I'll show you that here in a second. Kevin, can you see this screen still, or do I need to reshare? Okay. So this is the first page you would go to once you logged in, is your provider dashboard. So you can see there's some search functions up front, and there's also what we're calling tiles. So some tiles where we highlight some of the big groups that we have direct contracts with. So Hazelden Betty Ford offers lots of different mental health counseling as well as substance abuse treatment, inpatient, outpatient, a lot of options all over the country. And they're one of our big recent contracts that we have. So you could click right here on Hazelden Betty Ford and you could search those providers in particular. If you just happen to know that, oh, that's an interesting opportunity for me, maybe mental health virtually or in person, or you know that you might have some other inpatient needs for yourself or a family member, you could search them directly right there. You could also keep going down and see some of the other big areas. So the breast center, Carol Milgard, Proliance surgeon. So Proliance does a lot of orthopedic care for surgery centers. They have surgery centers all over the Seattle area. And then, of course, that one's familiar to you, Sound Family Medicine. Virginia Mason is our big hospital system, lots of providers, and then also hospital coverage as well. Any other providers that we don't have a big old tile for, they would fall into this section here. You don't have to click on these tiles to find someone. You could also just use the provider type search. So they did this in a couple ways. Some of it is by category. So if you were to just start typing allergy, you would see some allergy options pop up. You could also just search by provider. If I just happen to know my mental health provider's name or a counselor, I'm trying to remember one of our counselors that I could search for, but you could search, look down here and scroll. Like I can't remember her name, but I think this is the person, and click there. You don't have to list a city, but it's helpful for some of our providers that have lots of locations. Oh, shoot. She's not showing there correctly. Sorry. But you would be able to search and go through these either by grouping, which this group search over here is only by category. So it doesn't list the individual counselor or the individual provider location, or this one offers both. So it'll have something like Carol Milgard Breast Center, but it'll also have women's health listed down here. So this one's a little bit more detailed. There's a couple different search options. This, when we did this before, it was on a table that you got every week. So of course, our provider network just grows and grows and grows and grows. And I'll talk to you a little bit about how you can help have that provider network grow. But this is the start to what we hope will be a huge network that we continue to build. So if, as you're using this, you see little quirks to it and you think, oh, this should be connected, or I tried to search for counselor, but it didn't show this one, but it showed it if I was searching for mental health counselor, things like that, where you see we can engage the developers at Health2Business to make this better. Please let us know, because we'd like to hear that. We'd like to have this provider search be as useful as it can be to you. And we're also allowing or having HMA, those health advocates, and the people at customer service that you call in and ask the very same questions. I need a provider. I need to get an MRI. Where do I go? They'll also have access to this very same search. So they'll be able to use the same tools that you're using, and they'll also be giving us feedback. So we're hoping over time, this just gets better and better and better. I will show you, I talked about how you would help us build the network. That hopefully you can see is the provider nomination form. And this nomination form has gotten a little bit better. So we have it now in sort of a PDF fillable format. And then when you click submit form, it will automatically allow you to email that straight to Health2Business. So please do continue to use this. You guys have been great about offering a lot of different nominations, but there are times and cases where we're trying to build out a section of the network. Like right now, we're trying to build out pediatrics, and we're desperately trying to figure out where would be good places to start. That we can start engaging with providers that you would use in your community, and where should Health2Business kind of focus their attentions, if that makes sense. So these kind of forms really help them do that, so that we're not just throwing a really wide net. The goal with this tier 1 or tier 2 network, where we have direct contracts with providers, is to really tailor it to the Sound Family Medicine population, to you and to your dependents. So please continue to use this. And like I said, if you click submit form, it would allow you to generate an email and it would send it right to Health2Business. So this is hopefully also getting much more streamlined. So I will open it up to any questions anyone has. Has anyone had that opportunity to use it yet, by chance? It's pretty new, so that's okay if you haven't. Have you used it, Kiva?
I have not gotten to use this one yet.
Okay.
Kiva might be an extraordinary circumstance. She's currently living in Texas, so so she might end up having to use the broader network that's on the level 3 or 4. So, but as she is here in Washington from time to time, she can definitely plug into any of the things that we have here.
Yeah, and we do have some, I think there's an urgent care facility where we have contracts, and they have some locations, obviously different areas of the country. Certainly Hazelden Betty Ford for mental health has locations all over the country. And they do a lot of virtual health as well. But yeah, that is, and that's not to say that the Sound Plan wouldn't be interested in having direct contracts in other areas as well. It's your plan, it's your contracts. So that's what Health to Business does. That's their job, is to do those reach outs. So Kiva, if you're in the process of using the plan and you think, gosh, it'd be nice if we had a better contract with this person or just had them in our network, please do fill out the form and we'll see what we can do. That's
awesome. That's probably more likely for the private practices in our little areas, right? More so than like the big hospitals.
More than likely.
It's certainly more challenging for big hospitals, but a lot of times there's private provider groups that practice at the hospital, but also have their own practice. They might be able to contract at their individual location, but not necessarily be able to be hospitalists and treat you there. But yeah, I mean, that's everything from chiropractic and naturopathic care to and primary care to hospitals. And that doesn't necessarily say we wouldn't be able to get a contract with hospitals, but you're right, it is a little more challenging just because of the scale.
Thank you.
Mm-hmm.
Carrie, have you had a chance to look at this?
I have not yet. Since I just got back from leave, I just saw it. No, so I haven't quite yet.
Okay.
Hopefully soon.
Cool. Cool. Any other, thank you, Amanda, for reviewing that. This is really good information. Any other questions, Kiva or Carrie, that you guys may have on any other component of the health plan? Or
I do. We've had to actually use it a lot lately, and there is a lot of claims being processed incorrectly. I've been working with Advanta on that. Okay. You know, because there's specific places that we've been told to go to, and then I have $4,000 bills. So do you know if that's getting fixed and how quickly? Because, you know, I can only talk to these providers and ignore or hold off on the bills so long before I know for sure. Because like one of them is like wash gastroenterology, where my husband had to have a colonoscopy. Well, the doctor, I have a bill for her. I have one for the actual colonoscopy in the surgery center, which that I guess I get that part of it. But he had to have surgery at St. Joe's, which was where we were told to go. And I think that one's finally fixed, but it just seems like there's a lot that they're processing incorrectly. Do you know how that's going?
Well, they shouldn't be necessarily processing it incorrectly, but a lot of times when we go to a provider where we weren't able to negotiate, or even sometimes we do negotiate in advance, we negotiate in advance with director staff, and the person who sends out the invoicing frequently is contracted. They're not even necessarily an employee of that clinic. So there's a lot of times, you know, miscommunication where we agree to a price and then we were billed this price, and they've got to come together and make those things happen. But that's never something that you should be dealing with. And
right. Well,
even to the point of calling providers, that's something your advocate should be able to do, to say, hey, we're working on pricing for Carrie for this particular procedure for her dependent.
But these were how the claims were processed. And I was told, because they're going towards deductible when they shouldn't. For instance, I just had my hip replaced at Proliance, and I was told actually Advanta had called, or HMA or whoever it is, I get confused, had actually called them to say, no, there's no out of pocket. And now I don't have a bill yet, but I have the EOB saying that I have an $8,000 patient responsibility. So,
okay.
I was actually told by Advanta that all of the majority of Sound Family Medicine's claims have been processed incorrectly and going through the wrong network, the wrong tier, I should say.
From Advanta?
Mm-hmm.
Well, so Advanta and HMA are the same thing.
Right.
So that should be something they're communicating with internally and fixing. So if they're not doing that, that's news to us, but I appreciate you telling us. So I'm going to find out if it's, you know, an error on the EOB where the EOB is showing you the wrong number, or if they're just literally not paying what they're supposed to be paying. Really problematic, because Proliance is a direct contract of ours. So we don't want to ruin that relationship. We want that to be paid correctly.
And it
So-
sounds like it sounds like it wasn't a wrong amount on the EOB. It sounds like it was being processed through the wrong tier according to them. And I did talk to Donna like last week about it because I was at my wit's end trying to go through EOBs because I spent probably 3 hours a couple weeks ago going through all these EOBs because so many of them said that they're my responsibility, and I don't, according to what we've been told, I don't see how that is.
No, yeah, they wouldn't be. Not for tier 2, and I know ProAlliance is in tier 2.
Yeah. I mean, and there was other ones. There's St. Joe's, which is a CHI, which we were told to go to the ER there. That's another one that there's some weird stuff with that. So I don't know, just as long as you guys are aware of it.
No, I'm glad you're making us aware.
Yeah.
of it. We just had a call with HMA today, and your claims did not come up. So
Yeah.
we weren't aware of it. So it's something I'll look into. And
Yeah.
If you wouldn't mind, if you could send Kevin the best email you'd like me to use with us, you're working on your home, I can connect
Okay.
and get us some status for you and help interface with them just to save you.
Okay. Yeah. And I have,
hours doing anything for.
and I did find one gal with Advanta that's been super helpful, and I've been able to send her stuff, but it was just interesting. It was enlightening me to hear, oh, we've processed the majority of Sound Family Medicine's claims incorrectly. So we're working at reprocessing them, but we didn't, like, Donna had no idea about this.
No,
So
neither did
that, yeah,
Do you know
she's like,
who you're
no.
working with at
Yeah, it's like, I think it's Kathleen.
oh, Kathleen. Yeah, we know her.
Yeah.
She's our dedicated advocate.
Yeah, so she's been amazing. It's just, it's hard because I have spent, like I said, a lot of time on this because I know how providers are. They're going to send you a bill, and if the EOB says patient responsibility, that's what you're going to get the bill for, and they're going to end up sending you collections if it doesn't pay.
Yeah, that's absolutely true. And I mean, I think you did everything right, reaching out to HMA. The thing I would say is that the faster you can engage us through Donna or Kevin, the faster we can take some of that off your plate.
Well, yes, but I was told to reach out to them by Donna on the original ones.
Okay.
So that's why I started there.
Questions. Yeah. Yeah.
Yeah.
Well, and I think you're both right. I mean, reaching out to Advanta to initially engage, but if you're not making any progress there, then it's letting us know that, hey, it's not moving anywhere, and then we can get Amanda and her crew involved to help move. It seems like it's starting to move. I'm just curious how quickly we're going to know this, because, and then I guess if it's not the case, then education on our side as, oh, well, if you go to Washington Gastroenterology, which is on our list, no, you can't do that because it's not going to pay, because that's, you know, it's, and I guess part of it is just the fact that maybe it's, and I know a lot of this stuff, but part of it too is the fact that, oh, you go for a colonoscopy there, you don't realize you're going to get a 15 or, well, actually, I think it's a $3,200 bill because you went to Fogel Endoscopy, because that's only the place that they do their colonoscopies. That's the problem, part of the problem we're having. So I think, you know, making sure that employees understand that there's other people that bill, and they bill with different tax ID numbers. So that seems to be kind of a part of the issue too.
Okay. Okay. That's all good feedback. So, and good information. So I appreciate you sharing it. And
thank you.
We'll look into that right away and get you.
Okay. Thank you so much.
Any other questions? Thank you for sharing that, Carrie.
Absolutely.
Kiva, did you have any other questions?
Oh, nope, just I'm going to start looking around here now and start throwing people on the nomination form.
Yeah.
Okay.
Please do.
Good. Well, if we don't have anything else, we could end a little early and meet back again next month.
Okay.
All right. Well, thank you, Amanda. Thanks, everybody. Appreciate it. We'll get this video uploaded this week. So thanks again.
Thanks.
Thank
Bye-bye.
you.
Bye.